if a parent, typically the mother, says something is wrong, there's something wrong.
Yeah.
I know. I'm a mother and I'm a doctor, and I know my kid backwards and forwards. He blinks the wrong way. And I tell them, it may not be what you think is the cause, but if you see something different, there is something different. And I just hope our colleagues, continue to listen to the parents, because my parents are very smart.
Right.
They teach me things.
Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Welcome again to the Demystifying PANS PANDAS podcast. I'm Dr. Nancy O'Hara, and I am thrilled to welcome Dr. Rosalie Greenberg. Rosalie is doing such amazing work with our children and adolescents with tick-borne disease, with PANS, PANDAS, and I'm really happy to have her perspective today on the podcast. So thanks, Rosalie.
Oh, thank you for having me.
Well, tell me, how did you get to where you are today?
I feel like making a joke and saying, well, I took my car. And okay, I'm sorry. I mean, it is one of those days. Now, basically, I did my child and adolescent psychiatry at Columbia, where I went to medical school. And I hit psychiatry right at the time it became very biologically oriented. So I trained with some of the pioneers in ADHD, childhood depression, all of this. And so that started me on this track. I did more EKGs and read more during my psych training than my internship. So that tells you how it was. So I was very into, especially mood disorders. And over time, was seeing something that was different that we call pediatric bipolar disorder. Okay. But I keep going to conferences, and near the year 2000, I don't remember exactly what, I went to hear Sue Sweeto talk. And Sue, gave a lecture on PANDAS at that point. And 3 weeks later, I picked up my first case.
Yep.
And actually sent it to her, and he was in one of her trials. Okay. Well, but another kid, I had a kid that bipolar, and I got to be pretty good at this, okay, in treating bipolar kids. And he had been hospitalized 3 times in a year. Columbia, Cornell, whatever. They said he was bipolar, but he would just get out of control and aggressive and psychotic. And okay. So his therapist, his psychiatrist told him, why don't you come back when he's a teenager and maybe it'll be easy to work with him then. And when they came and told me that, I said, oh my God, it'll be impossible at that point. So anyway, I medicated him for a few months. He was really good. But then he started having behavioral outbursts. And I knew he was going to go to residential treatment. And I tried to think, what can I do? His mother said he never had a strep. What the hell? His ASO was 800 something. There you go. And then she did say, oh, yeah, his sister used to get strep a lot. He's never had a strep. Well, guess what?
Yeah.
Anyway, so I sent him to one of the people I work with PANS of PANDAS, and he was placed on antibiotics, and it took a few months. And then he comes into my office, and I saw something I've never seen in my life before. He comes and says, hi, Dr. Greenberg, how are you? Sits on my couch, leans his head on his mother's shoulder. And Dr. Greenberg, I decided I want to get all A's. I'm really going to do my homework. And I felt like I was in the Twilight Zone. I've never seen anything like this. And so and I wrote his case up actually. And that was kind of the beginning of really getting into this stuff. So then, since most of my practices, I'm known from pediatric bipolar, most of the kids pretty much have that diagnosis. They're coming for a second opinion or whatever. And I just decided, let's get strep and mycoplasma on everybody who comes in. Let's see what it is. Well, more kids were positive for mycoplasma than they were for strep. And then I heard somebody give a lecture and mention that, ticks carry mycoplasma. Well, I live in New Jersey. I'm from Brooklyn. We didn't know much about ticks, but okay, let's find out. And I start reading about ticks and entered the world of Lyme, Babesia, Bartonella, which spun my head around and changed my whole view of medicine.
Yeah, yeah. I mean, it's done the same for both of us, and you've written multiple publications. You wrote the book on pediatric bipolar disorder.
Yes.
And it's amazing. If nobody's read it, please do. But, you have such a great way of looking at these children from that biological approach as a psychiatrist. And I love that. And it's interesting. I just wrote one aside. I ended up going to Penn. Both my parents had gone to Columbia, and they really wanted me to go.
Oh.
But when I went to interview, the doctor that was head of psychiatry, I was a teacher at the time. I was teaching children with autism, and I was going to be a psychiatrist. That's what I was going to medical school to do. I had worked with a psychiatrist at the Timothy School in Philadelphia, and that's what I was going to medical school to do. The gentleman that was the head of the pediatric psychiatry department at Columbia at that time still believed in the refrigerator mother theory of autism. And that was I started medical school in 1984. And yes, so this was 1983 when I was interviewing. And so he said, I'm the one that has to present you to the committee. What do you want me to say? And I said, please say that I'm not interested because I don't want to work with somebody that still believes the refrigerator mothers cause autism. I ended up going to Penn, but it was quite an eye-opener at that point in time. But anyway, I digress. So when we talk about PANS and PANDAS, certainly PANDAS is the neuropsychiatric disorder associated with strep. And, it's a clinical diagnosis as much as tick-borne disease is. But what we see is that it is really an immune modulated disease. It's an immune intolerance. And so these children that may start with strep, often in the areas where you and I practice and live, they get tick-borne diseases, Bartonella, Babesia. And how does that change the picture for you psychiatrically?
Well, very much, because what actually I had done after I found my new patients kept having tick-borne disorders and treating them, by antibiotics or whatever, helped them be more responsive to psychiatric medications. I said, I got kids that I've treated for 10 years for their pediatric bipolar since they were 4. Could they be positive? Yes.
Yeah.
So I wound up publishing. I published my newest one. I haven't published it yet. I presented it. It's 37 bipolar kids.
Yeah.
And 75% are positive for tick-borne illness, which is crazy.
Yeah.
But it's crucial to know that because that makes such a difference in treatment. The kids who are treatment resistant, I always say if you're treatment resistant, you're just looking at the problem the wrong way. You're missing something.
Yep.
Okay?
Absolutely agree. Yep.
So if they're not responding to your meds, what are you missing?
Yep.
And it is amazing because once they get properly treated, most of them become more med responsive.
Right.
But parents are always afraid of psychiatric issues. So even though they're coming to me and don't really want psychiatric meds, but they know their kid is suffering and they really care. And I just had this just the other day with some lovely parents. The youngster, she's around 14. And they told me about she's got really bad OCD, but it's especially the intrusive thoughts of wanting to harm somebody that you love, or death to them or whatever, which is such a torture.
Yeah.
And so I said, well, has she been ill? She had 3 sinus infections in the last year. And I said, the sinus is the weight of the brain. Yeah. That's it. That's how the immune system does it. And I said, look, you got to do homework for me. You got to go back, look at your medical records, because they said the first time it occurred, she was in 1st grade. Go look at your medical records around that time. See what you see. And she wrote me last night, gee, you were right. She did have a nasal infection, and it was really a problem. And then soon after that, that's when it all happened.
Yeah.
Ta-da!
Yeah.
And it's amazing. I think people look, but they don't see.
Yeah.
Or they don't take the time to look. I mean, one of the things that we have in common is we're really detectives. We're really trying to get at what the underlying triggers are, not just medicate, but figure out, are there triggers we're missing? Because as you said, they're resistant to medications, et cetera. So in this 3-pronged approach, and we always, Sue and I were talking about that in an earlier podcast, the treating the triggers with antimicrobials, antibiotics as appropriate, treating the immune system with immune modulating agents as appropriate, and then treating the symptoms. And certainly I try to treat those symptoms with nutraceuticals, other things, but we do have to go to antidepressants. So talk about the role of antidepressants in treating youngsters with these disorders.
Okay, I'm not a big fan of antidepressants.
I know.
I really am not.
I agree.
And I think that's the mistake people often make. They see these kids, they put them on antidepressants. The kids appear worse. Well, especially if you're one of my kids, you start becoming manic in mixed states, and you want to kill yourself, you want to kill somebody else, and you're psychotic possibly. Or you just have such disinhibition that they can't stay still, they can't pay attention, they can't, maybe had an underlying ADHD. Okay, throw in meds for that. Well, if you want to make a kid who might be bipolar, psychotic, I like the combination of antidepressants and stimulants. That's a strong one.
Just in case anybody didn't get it that's listening, she was being facetious.
Oh, yes, thank you very much. Please. Because the thing with antidepressants, if you use them, you really first should check, is there bipolarity in the family?
Yeah.
I think that's crucial. And even if there is, that's not a contraindication, but it tells you, watch that kid like a hawk.
Yeah.
Start very slowly. Go up very slowly. And I've had kids on 1 milligram of Prozac.
Yeah.
I mean, it's 1/4 milliliter. But that's what they needed. And it worked.
Yeah.
And when I took it away, they got depressed. So, and the thing is, since the infections bring out your biologic predisposition, and many times we don't know what that is, all the more reason for caution. Yeah. And I'm not a fan if you have something and then you get a side effect, adding another medicine for the side effect. I mean, our goal is not to, have somebody need a pharmacy every day. That's why I think nutraceuticals are wonderful. On the other hand, the kids I see are pretty sick.
Right.
If they're making it to a psychiatrist, generally they're pretty ill.
Yeah.
Okay?
Yeah.
And, parents, is he going to be on the medicine, forever? Or what? Let's get him off right away. And as a parent, I totally get it. Okay? But the most important thing is for your kid to be able to function.
Yeah.
For your kid to be able to. My goal, if I do it right, is to give a kid a childhood. Let them have a childhood.
Yeah.
And what greater thing can you, right? Nancy, that's like the best thing we can possibly do.
Exactly.
That's what we strive for.
Yeah.
So, I wind up, I do. If the kid's throwing things at his parents and threatening every day, I don't care what infection he has. If you can't control that rage, you can't have him at home and you can't treat him.
Yeah. Absolutely.
So, I mean, and I think people, it's like either or. You treat the infection, or maybe we'll go to psychiatric. Um, and like I said, many times they've seen psychiatrists, but the kid hasn't responded. Again, what are they missing?
Right.
And I can't emphasize that enough for what I do, because biology is destiny. I really believe that.
But you just said it in your publication or about to be published article. 75% of your patients with bipolar have tick-borne disease in the background. It's a staggering number that are being missed. And I was just at a PANDAS Foundation meeting, and several parents were there with their children had committed suicide, and never had found any of these problems. And fortunately, there is a brain bank. All of the parents that were at this meeting had donated their child's brain. And I know it's a very difficult subject, but they had found tick-borne disease or basal ganglia inflammation, evidence of an infectious triggered inflammatory, condition within the brain. And it had been missed.
Well, I think also sometimes people, they confuse things. I mean, we all do. But with strep, we know it's more an autoimmune reaction. It's not that the pathogen, it's not that strep gets into the brain. That's different with tick-borne illnesses.
Yeah.
And so that affects your treatment too, because, well, you want to give steroids perhaps to someone who has strep. You're not going to run to do that if you have somebody who has an infection already in their brain. Just to help the spirochetes multiply just doesn't sound like a good idea. You're right, I am very sarcastic. Okay. Well, it's just because I think people want a simple answer, and God, I wish it was so simple.
I know.
But that's why sometimes I'll have a kid that comes to me and they have been on rituximab or something else. And that wasn't the best choice for the child, because they really needed to get rid of the bugs, not to dampen their immune system.
Right. I hear you. And I think, I reinforce to parents all the time, this is an infectious triggered, but immune disease. And we need to do that, but we also need to treat the symptoms that they're having. And some of them, they come in, nobody in the family's sleeping. We got to get them sleeping. Nobody's going to be able to function. There are many symptoms we need to treat.
Well, many times mothers quit their jobs, right? Haven't you had that a lot?
Oh, yeah.
One person just has to be there for this kid.
Right. Now, you mentioned a minute ago, that people are worried, I'm putting my child on a psychiatric drug. Will he or she need it forever? And it's a question we get asked all the time. They're already, the child is 7. They're already thinking about when they're going to prom. Well, how do you usually talk about that with families when they ask those questions?
Well, I'm very honest with them. I said, look, there aren't studies that can answer that question for you. I can tell you from my experience, working with hundreds of kids, that there are probably 3 groups. There is one group that they need the psychiatric medicine to help them kind of be in control, maybe go to school and function a bit. But once they get treated for the bugs, they actually may not need that at all and don't need psychiatric medicine.
Right.
Then there's another group. They will need to stay on some psychiatric medicine. Probably not as high a dose as when they were at their sickest, but they may well need it. And especially like the ADD stuff that doesn't go away easily. So they would need the stimulant if that works for them. And then there's another group that absolutely, they're very ill. They have, the infections, they have schizoaffective disease. It's usually, you'll find it in the genes, and they're going to need to be chronically on psychiatric meds and monitored. To me, the most amazing thing I think of what I do is seeing the herxing occur psychiatrically.
Huh.
I love that because who would have believed that? Somebody comes to my office and they're enraged and upset, and I said, okay, go home, give him 2 Motrin, and call me in 3 hours. Let me know how he is. Oh, he's calmed down.
Yeah.
Where did one ever see something like that?
Yeah. Yeah.
I mean,
It's an inflammatory condition. Yeah.
that's right.
Yeah.
It is just astounding. But so the psychiatric condition, yes, it's there, but you got to have the kid cope with life. You got to provide all the supports as you deal with the infections and see what happens with the psychiatric stuff.
Yeah. And what about, we talked a little bit about antidepressants. There are lots of other psychiatric medications. What about antipsychotics? Are those sometimes required?
Absolutely. Absolutely. If you have a youngster who is hallucinating, there was that case that I wrote up for one about the boy, a 14-year-old who was diagnosed as schizophrenic, who had Bartonella.
Yeah.
And 3 people said he was schizophrenic. But it was a fairly sudden onset. He was seeing things, he was hearing things, he thought his dog was the devil. And this poor kid, it wasn't, but he was on every psychiatric medicine known to man. Nothing worked.
Yeah.
Then somebody noticed his stria. And that changed everything, because then he got treated for the Bartonella, and he really was able to get off the psychiatric medications.
Yeah.
I mean, he was able to go to college and do well.
Yeah.
And that's what we want.
Right. And for those of you who are new to the podcast or don't know anything about Bartonella, the striae that Dr. Greenberg is talking about are blanching stretch marks that don't follow dermal lines. Usually they're vertical or horizontal. They don't follow those lines that we usually see when we've got weight changes. And as I said, they blanch, they change color when you press on them. So that's a classic sign of Bartonella. And I've seen it, Rosalie, on the knee, on the forehead,
on the breast.
Yeah, not
arms.
Yep. Not just on the trunk. And
Absolutely.
other symptoms that you see psychiatrically also or otherwise let's start with Bartonella.
Well, Bartonella people often think of as associated with rage.
Yeah.
Because often these kids are angry, irritable. You look at them, what they think is the wrong way, and they start screaming at you.
Yeah.
You don't even say no. You're just talking. Why are you yelling at me?
Yeah.
And everything is perceived as a conflict. And that's for a parent. It's hard enough. You got a sick kid. You can't even get him to school. And then he's fighting you on everything, taking the medicine, doing what he needs.
Yeah.
It's very, very hard. So Bart, the classic thing, though, is the stria, but that doesn't occur, my observation at least, until after puberty. I've never seen it on a pre-pube. And I've asked around. Okay, have you? You got to...
I'm thinking.
I don't think so.
Yeah, okay. I'm going to have to go back to my records. That's interesting.
Yeah, I haven't seen it on a pre-pube.
Interesting. Okay. Yep.
So we got the stria. We also got these temper outbursts. Of course, they can have the OCD and tremendous anxiety.
Yeah.
And the mood swings.
Yeah.
It's the thing that people don't realize, or not don't realize, but I think we all don't appreciate, that the whole body's connected. So, man, if something's going on up here, something's up there in your gut, too.
Yeah.
And it's very interesting because I have a young man who has, he's had multiple tick-borne issues, okay, as well as psychiatric. And he wound up having ulcerative proctitis, which means, at the end of the rectum, by the anus, he was having some blood in his stool. And I had them take some of the biopsies, and we were able to find the Bartonella in the biopsy. Okay. And he's got a lot of striae. It's a case that I'm actually presenting in a write-up. And so Bart may actually be involved in some cases of inflammatory bowel disorder.
Yeah.
Okay, so he and I were talking last week, and I don't know how he got to it, but he said, yeah, last December, remember when I wasn't feeling well, he was more depressed, he was more tired and whatever. That's when he bled for the second time.
Mm-hmm.
And that was just his whole body saying, I'm inflamed, guys,
Yeah.
look at me.
Yeah. And that's what we see all the time, whether it be eczema or asthma or inflammatory bowel disease or, arthritis of different forms. And I always caution people when we hear about arthritis, arthralgias in our kids with PANDAS, I really feel we're not looking far enough and close enough for any of the tick-borne diseases. It may just be autoimmune reactivity. However, when we have joint pains, heel pains in Bartonella, for example, or sore soles of the feet, we really need to be looking for these tick-borne diseases, in my opinion.
Well, what's very interesting, I've done some work looking at Polly Murray's writings. Okay, Polly Murray, for people who don't know, she was the one who first presented the Lyme symptoms, to the doctors at Yale, to the rheumatologists, as well as another mother called Judy Mensch.
Yeah.
Okay, so they presented. It was a gift, basically saying, look, you can't have 4 cases of rheumatoid arthritis within juvenile rheumatoid arthritis in 3 blocks. That makes no sense.
Right.
And so the rheumatologists went and studied it. But they weren't psychiatrists, as well as other kinds of physicians. And so that created a more narrow view and focus of Lyme.
Right.
Focus on the arthritis.
Right.
Polly Murray actually wrote down notes about everything. The woman was so smart. It was amazing. And she wrote about how many people in her neighborhood had neuropsychiatric issues, from strokes to psychosis. Just amazing.
Yeah.
And it was there. It was there. It just, it's something I'm trying to put together again for another article. But
we have to keep putting together.
Right. But I think that's so important because it was there.
Yeah. Yeah. And I think medicine, one of my, big complaints, I guess, about medicine these days is we have become so fractionated.
Mm-hmm.
In my parents' days, they were both GPs. They were the medical home. They were it. That, there weren't all the other practitioners as we refer to today. And I think as we become more and more specialized, we're not looking at the whole body, particularly the connection between the gut and the brain, but the whole thing is not looked at together.
I agree with you. And yet you really need that if you're going to properly diagnose and treat.
Right.
The whole body really is connected. It doesn't, cut off at the neck.
Right. And Rosalie, I'm seeing a lot more babesia in the last few years. We know 41% of our ticks in this area carry babesiosis. Are you seeing more of it? And what symptoms with that are you seeing particularly?
Well, babesia, yes, I'm seeing more of it. But the truth is, I've seen a lot of it since I did the work with the bipolar kids.
Wow. Okay.
Because what happened is, I learned about specialized testing. And so I started using IGeneX Lab. And there's the babesia fish. And for people who don't know, it's fluorescent in situ hybridization. Fancy name. But basically, you look at the slide under the microscope. If you have 3 red blood cells that contain the organism, you call it positive, right? Well, that's direct visualization. You're using your eyes. That's a pretty good test. It's not because something else got abnormal. And then one of my patients told me how they went to see someone to get them their antibiotics, whatever. And the doctor said, oh, how unusual. I never get positives on these. And I thought, I have 17. What is he talking about? So I called up the head of IGeneX. I called up Dr. Shaw, and she went through it with me. And she was like, oh, my goodness gracious. It was outrageous. So, and actually that was the most common infection, tick-borne infection in my group.
Yeah. And it is the most common now in our area. Yeah. Yeah.
And I think, yes, what is in the literature, there's just a little bit about its association with depression in adolescence, and also a little bit written about it and anxiety.
Yeah.
Okay.
Yeah.
But there really hasn't been good, strong focus on it.
Right. Yeah. And it is so missed. And we're seeing a lot of it post-COVID activation too.
Okay.
I think COVID has reactivated some of our dormant viruses, maybe some of the dormant tick-borne diseases. And from our perspective, I think that's why we're seeing so much more of it. Maybe we just weren't looking as well before.
No, I agree with you. I think I've found that my colleagues have too. You get reactivation of Bartonella.
Yeah.
Or the Lyme, or the Babesia, or all of the above.
Absolutely. Absolutely. Well, Rosalie, we in the Northeast are so lucky to have you as one of the psychiatrists that are there to see our kids. But how can people find you if they would like to see you? Are you still taking patients?
I'm still taking patients. You know, the rule is you can't treat people in other states.
Right.
If you don't have a license. What I do is I try to be a consult and work with somebody who's on the ground in that state.
Yeah.
Okay, and discuss it with them. Because these kids are tenuous. They can change in 10 minutes and they can become suicidal. And I wouldn't want that responsibility anyway if you're out in California. I want somebody who can be there for you, who can look at you, who can, make the right moves.
Right.
So I serve more as a consultant, I would say. But it's great. I've had some very, very interesting kids, from all over.
Yeah.
Well,
the mentoring is great. I do it a lot also for practitioners all over the country, all over the world. We're both lecturing for ILADS. You've lectured all over the world for them, and great lectures. If you've never heard Rosalie talk, really a wonderful lecture to listen to. Rosalie, are there any tidbits, any pieces of hope, anything you would like to leave families or practitioners with about the kids that you take care of with PANS, PANDAS, or tick-borne disease?
Well, I think for everybody, if a parent, typically the mother, says something is wrong, there's something wrong.
Yeah.
I know. I'm a mother and I'm a doctor, and I know my kid backwards and forwards. He blinks the wrong way. And I tell them, it may not be what you think is the cause, but if you see something different, there is something different. And I just hope our colleagues, continue to listen to the parents, because my parents are very smart.
Right.
They teach me things.
Yeah. I was lucky enough that one of my mentors, or my main mentor, was Dr. Sidney Baker. And his main motto was, if you listen, they will come. The parents are our greatest teachers. And I think it is such a great piece of advice, because as practitioners, we need to listen to the people on the front lines. You and I are just their GPS. We may give them a good route to go down, but they're still driving the car. They're still on the front lines with the kids, dealing with the rage and the anxiety and the intrusive thoughts and all of that. So.
Absolutely. If the mother says he's getting more depressed on the antidepressant, listen.
Yeah.
Listen. Those are the kids that wind up, making suicide attempts and whatever. They're telling you important information, but you have to listen.
Yeah. Well, thanks for talking to us. We've been listening, and I really appreciate it, Rosalie, and I'll see you soon in the future.
Great. Thank you for having me.
Thank you.
That's it for today's episode of Demystifying PANS, PANDAS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS, PANDAS.